Good day everyone, my name is Kian Luis Tabor from BSN2A and today we will discuss the pharmacology in nursing, the respiratory system. So let's start. So this is the table of content of our discussion. First one is pathophysiology, next is drug classifications, next is bronchodilators, and the fourth is corticosteroids, fifth is antihistamines, and the sixth is decongestants, seventh expectorants and mucolytics, and the eighth is antitussives, ninth is nursing implication, then 10th is case sample, and lastly is the summary. So pathophysiology, common respiratory disorders, asthma, COPD, allergic rhinitis, cough and colds. So this is the allergies cause narrowed airways, inflammation, and mucus buildup, which lead to difficulty in breathing. So drug classifications, bronchodilators, corticosteroids, antihistamines, decongestants, expectorants and mucolytics, antitussives. So these are the 6 main groups of drug for respiratory problems. Yeah. Next. So the bronchodilators. Bronchodilators, this is the drug relax the airway muscles, making breathing easier, and they are used for asthma attacks and COPD. Example, salbutamol, and nurses must monitor breathing and heart rate. Corticosteroids. So corticosteroids are a drug that reduce swelling and mucus in the lungs. They are for long-term control of asthma and COPD. Nurses should remind patients to rinse their mouth after use to prevent oral thrush. Next. Antihistamines. So the antihistamines is a drug that blocking the histamine, which cause allergy symptoms like sneezing and runny nose. They are used for allergic rhinitis, and first generation drugs can cause drowsiness. So decongestants are drugs shrink swollen nasal blood vessels to relieve congestion. They help in colds and sinusitis. Overuse of nasal sprays can cause rebound congestion, so patients should use them for only a few days. So next, the expectorants and mucolytics. So expectorants thin mucus, so it's easier to cough out, while mucolytics breaks out thick mucus, and they are used for productive cough. Patients should drink plenty of fluids when taking this drug. Antitussives. So antitussives, it is a drug that stop cough by acting on the brain. They are for dry cough, not for cough with phlegm or phlegma, and sometimes can cause drowsiness and dependence. And next, nursing implication. Nurses should always check the patient's breathing before and after giving medications. Teach correct inhaler use, explain side effects, and encourage therapy compliance. And remind the patients to avoid triggers. So last is the case example. So our case example is a patient 18 years old with asthma attack treated with nebulized salbutamol. So the nursing action is monitor the RR or respiratory rate, heart rate, patient response, and our patient education carry rescue inhaler, avoid triggers such as smoke and dust. So an 18 years old with asthma was treated with nebulized salbutamol. The nurse should monitor breathing and heart rate of the patient and educate the patient to always carry an inhaler and avoid smoke or dust. And of course, um, educate the watcher to always remind the patient to always carry an inhaler and make the patient avoid smokes because it is dangerous for the patient with a asthma attack. So lastly, the summary. Respiratory drugs help manage bronchoconstriction, inflammation, cough, and congestion. Six major classes: the bronchodilators, corticosteroids, antihistamines, decongestants, expectorants, and mul- mucolytics, and antitussives. So, nurses play a key role in safe administration, monitoring, and patient education. So, that's all. Thank you for listening and watching. Bye bye.
Stop share.